Welcome back to NTV News First Edition. Get ready to fall back into standard time. The clocks will go back 1 hour at 2 a.m. this Sunday. Now that means it's going to get dark earlier, and for many of us, those shorter days may lead to seasonal depression. Well, to help us cope with the changing of the seasons is clinical child psychologist Dr. Janine Hubbard. Thank you so much for coming in.
Oh, thanks for having me.
You know, we hear about the winter blues. Is that a real thing?
Well, it is in many ways. You've heard the term seasonal affective disorder. You've heard winter blues. The whole condition was actually renamed a couple of years ago to be depressive disorder with seasonal patterns, which isn't nearly as catchy as some of those other terms. What we know is that about 2 to 6% of the population actually experience a fairly severe form of clinical depression during the winter months, and then approximately 15 to 30% of us do experience what we often refer to as the winter blues. So there is a noticeable change in our mood and our mental health and our demeanor during the winter months.
So how do we know if we have the winter blues? What are the symptoms?
Well, here's the hard part. It's things like sleeping more, feeling lethargic, not wanting to go out and engage in activities, eating a lot of carbohydrates and putting on weight. Sounds like a lot of us every winter.
Yes.
The question is the degree to which it disables and the fact that those symptoms, they disappear really quickly when springtime comes.
So who's most at risk for the winter blues?
Middle-aged women. People between 20 and 50, and particularly women, and those who live in northern continents and especially places that aren't getting as much sunlight. So Newfoundland is a prime target.
So how do we take care of it? How do we treat it?
There's a couple of things. What we know is we don't completely know what causes it, but we know it has something to do with our lack of exposure to sunlight and alterations in our melatonin and our serotonin levels. So what we need to do is kind of boost those. So on one hand, things like the phototherapy lights that have really come down in price and are quite inexpensive now are a great strategy. Vitamin D supplements, although I always say check with your pharmacist or your physician. But fighting the instincts. So even if it's cold out, if it's a sunny day, get out, go for a walk, snowshoe, hike, get the dog out, and as much as you can, try to resist those lifestyle potato chips and have the exercise instead. But if you are one of those people for whom it hits you in a really severe, debilitating way, please be proactive and do seek out help. There's a combination of some medication and some psychotherapy that can be really helpful for it.
We don't have a whole lot of time left, but before you go, COVID-19. So do you believe this is going to be an even bigger problem this year because of that?
This is exactly why I wanted us to talk about this tonight, because if ever there was a year for people to be proactive, the mental health and medical community are really concerned that this may be an extremely bad year for seasonal affective disorder, winter blues, whatever you want to call it, because people are already going into it feeling cooped up, feeling cramped, feeling all of those things that often happen in winter. So please, I'm asking people, be proactive, be mindful of your mental health, and if this is something that you've suffered from in the past, don't be shy about reaching out and asking for some help with it this year.
Dr. Janine Hubbard, thank you for coming in.
Anytime.